Lipolysis is the medical term of the breaking down of fat. It can happen in a number of ways, from dieting to exercise or surgery. When you are not eating or you are exercising, your body must draw on its internal energy stores. For that, fat is broken down inside fat cells to generate energy by a process called lipolysis. During lipolytic processes, triglyceride in white fat cells are hydrolyzed to the end product glycerol and free fatty acids, which is delivered in bloodstream and metabolized in other tissues. When we eat a lot of food, our body will store the excess food or sugar in the form of fat in the adipose tissue. Look at the picture. Here you can see the adipose tissue is composed of adipocyte or adipose cell, or you can say fat cells. In this cell you will find the fat droplet. Of course, the main role of this tissue is to store energy in the form of fat. When our body needs this energy, the fat will break it down to give us the energy which we need. But when you will eat too much food, a lot of fat will accumulate, compromising lipolysis, which will cause obesity, which is a real health problem. Look here in the picture. You will see how many diseases are connected with obesity. You will see see diabetes, some liver disease, coronary heart disease, high blood pressure, high cholesterol, stroke, and obese people usually die 10 years before normal people. People who have fat on their stomach are more likely to get diabetes and have higher blood cholesterol level. There is two ways to measure your health and fitnesses. The first one is body mass index. The second one is body percentage. BMI is a measure for shape based on weight and height, but BMI doesn't distinguish fat from muscle. Fat percentage is a measure of your body composition, how much of it is fat. Unlike your weight, your body fat percentage show exactly how much your body is made up of fat. In this chart, you will see your body composition of fat, and you will know if you will consider you have obesity or if you are normal. First of all, look here in the beginning of the table. You will see the essential fat. You will see that women need at least 10 to 30%, of course, because female body is different from male. You have breast, you have something like this, and we all know the fat is very important for all male and female. Fat is important to store energy, protect organs. It's also essential for hormones. It's not only for store fat. It have many benefits in our body. But if you have too much fat, like 32% in female and 25% in male, now we are in the red area. We are obese now. We are considered as obese. Why we need to know the fat percentage? Why we need to know the percentage of fat and muscles? Look at this picture. You will see 5 pounds of fat and 5 pounds of muscle. As you see here, the fat take more space than muscle. The muscle is more compact, so it takes less space. And the muscles burn more calories. So this 5 pounds of fat burn only 20 calories a day. But the same amount, or the same amount, the 5 pound of muscle burn 25 calories per day. So look here. So muscle take less space and burn more calories. Look here. Look here the picture. We have two guys. One has a great body, athletic body, and one is fat. But take this price. Both of them have the same height, the same weight, and the same BMI. Okay, how? The answer is because the one with the athletic body, his body consists from muscles, more muscles than fat. But the fat guy, his body consists from fat. So most of his body is fat. Okay. So for that we need to know the fat percentage, because the BMI not always can give us a exact result, a good result. Is how to break down fat stored in the body. Focus here. I will give you some tips. First of all, change your diet. How to eat more raw foods, low fat, calories, and high fibers, rich vitamins, mineral. These vitamins and mineral help activate enzyme that burn fat, help carry away the excess fat. Second way is to eat a high protein diet. I think you always see the guys who consider who goes to gym. They take some proteins. Okay, why? Because if you want to build muscles, you have to take a lot of proteins. When you take a lot of protein, you will activate the lipolysis. You will lose more weight. We see in previous slides, one pound of muscles burn more calorie than pound of fat. Okay. But when you eat a lot of protein, you have to reduce the carbohydrate, especially white carbohydrate. The third one is high fat, low carb diet. You will be surprised when you say that. How I can eat high fat and I can lose fat? Why? The theory said when you eat a lot of carbohydrate, the insulin level will be high in your body, and your body will store a lot of fat. Okay? But when you eat fat, when you get your calories from fat, the fat will not will increase the insulin level like carbohydrate. And there is some research said that when you eat high fat diet, you will stimulate the lipolysis. You can count the calorie. You can count the calorie because most of us need only 1,050 calorie, 1,000 calorie in a day. Okay, you can stick with this calorie, but take a lot of fat diet. Of course, good fat, not bad fat. There is good fat. Okay, good fat like omega, something like this, omega 3 or something like this. The second thing is doing exercise. You need to do exercise regularly. The medical advice 30 minutes per day or 150 minutes per week. Start by walking if you have not exercised regularly. Then you move to longer and more various walk or more strength activity like jumping, bicycling, something like this. But what the best fat breaking down exercise? The best ever is to lifting weights because it's improve body ability to metabolize fat and use it for energy will also increase calorie burned after you work out. We see before the muscles burn more calorie. If you build more muscle, you will burn more calories. The second one, circuit training, which involve the serious exercise, training, cardio, or both, one after the other, with no rest in between. Why it works? Similar to high intensity interval training, the fast piece of this workout keep the heart rate elevated, allowing you to burn more calorie and use fat more efficiently to fuel your body. It's also contribute to afterburn, allowing you to burn more and more and more for hour after you work out. But sometimes diet and exercise are not enough. There is always areas in our body resistant to diet, resistant to exercise, and sometimes we are get tired from dieting and exercising. So there is many cosmetic medical technique are used for reduction of subcutaneous fat, which subcutaneous fat is the fat under the skin. We have ultrasound lipolysis, is non-surgical produce, is very effective, safe, simple. We have also laser lipolysis, eventually new liposculpture producer for removal of fat. For example, we can use it for the double cheek problem. Look here the picture. Before we have a chin with a lot of fat, but here we have, but after we have a very nice one. We can of course use it for area resistance to diet. It's very good technique. Is safer than the traditional liposuction. We have also injection lipolysis, which is controversial cosmetic produce. Why? Because here we have a drug mixed and injected to the patient to the goal of breaking down fat in this area. Okay. We use some medicine or some drugs, and then we put it in with this formulation. For that there is maybe the ultrasound lipolysis and laser is safer a little bit than injection lipolysis.